Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare.
Hello and welcome to the Medicine's Use Group podcast for all things pharmacy.
Welcome.
So we've got a very special guest today. We have Fiona Rees, who is the lead pharmacist for Gastroenterology at University Hospital Sussex NHS Foundation Trusts. Thank you for joining us.
Oh, hi everyone. Thank you for inviting me. It's a pleasure to be here.
Very good to have you here. I was actually just remembering that we've got a longer history than I first appreciated because we worked together on pre-reg OSCEs, didn't we?
That's absolutely correct. Yeah, in one of my roles. So when Connor was like, "Do you know Sian?" I was like, "There's no need for introduction."
No need. We go back, way back.
It just shows the small world of pharmacy. It's
absolutely
smaller than 7 degrees of Kevin Bacon. I'm pretty sure it's 3 degrees.
3 degrees, yeah. I still hear people going, "Oh, you used to work at UCLH." I'm like, that was a very long time ago.
Yep.
So yeah, your name gets around a bit.
Hopefully in good ways, right?
Yes. All good.
It's always good.
So we've got a set of questions for you, which I hope you'll be happy to answer. So the first question is, what is a specialist pharmacist and what sort of activities do you get involved in?
I think that's a really interesting question. And I think the answer I give now will probably be very different in a year, 2 years, 5 years' time. So, apologies if you're listening to this and it's a bit out of date now. But first of all, I think we need to remember that pharmacists are specialists in drugs. That's all pharmacists. So just know your worth in the MDT. And that's not just the MDT in hospital. I think a lot of people think that only exists in hospital.
Yeah.
It exists in community pharmacy. It exists in GPs. It exists in industry and every other new place that pharmacy is going into. So just make sure that you know your worth. You are the specialist in drugs. You've done 4 years at university for this. So I think that's the first thing. With regards to actually what specialism means to me, I think it's any activity that's beyond foundation work. So for me, my foundation work, which I can talk about later if you like, was very much my trainee year and then my what they called back in the day residency. So it's where you become a jack of all trades, basically.
Yeah.
Master of none, I think is the phrase. And I think you can map when you go to specialty activities either by your peers around you or by using the advanced level frameworks that are available, and you just start looking, okay, well, I am doing this project. Does this work as a specialism? So it's not necessarily about the clinical area. It can be about the activities you're doing as well. Obviously, if you're then becoming more specialist in a certain area, so for me that was cancer and then gastroenterology, the more knowledge you're getting from those areas, the more specialist you're becoming. And I just want to make a point as well, is that we do have, and there is a very big need for specialists in generalist activities. So, GPs is a really good example. They're generalist specialists and pharmacy is working within these areas. So I think it's important that you don't have to have one area that you're good at to be a specialist.
That's a really interesting point, isn't it?
Yeah.
A generalist specialist or a specialist generalist?
I think either or. And I think the phrase is becoming more and more ingrained now in kind of when we talk about professionalism. So again, it might have a very different phrase in a couple of years.
Yeah.
I might have got it wrong, but a lot of the pharmacy teams that are working within GPs, some of them may have come from hospitals. They might have been very specialist within pain, for example, and they've transferred their skills to work in a GP GP practice now, and they're not only just looking at pain relief, but they may be in hypertension clinics, they might be in anticoagulation clinics, they might be in rheumatology clinics. And so they've taken their specialism of pain and actually mapped that across several other specialisms, and so becoming more of a generalist like you'd see maybe in GP.
Okay.
It's almost as though half of it is the clinical knowledge and
Yeah.
half of it is the professional skills, and the clinical skills that you're applying is the specialism.
And I think that's really important. As pharmacists, we have, and pharmacy as a profession, we have so many transferable skills. So, you know, if you fancy something else, don't think, well, I haven't done it before. Think of those transferable skills to put into that area.
So you think going down one specialist route of a particular clinical area shouldn't then stop you from going off into another clinical area? Or
Absolutely not. And actually, that's exactly what I did.
Yeah?
I
Oh,
definitely
okay.
specialised in one area and moved to another. So I'm definitely an advocate of taking the opportunities where you want to develop and see how it goes.
Sounds good. What does your average day look like? Your average day, your average week? What actually happens on the ground for you?
Yeah, so just to kind of let people know, generally my job is I work in a hospital pharmacy department, but actually my job is mainly outpatient based, so it's quite confusing. So there aren't many jobs like this at the moment, but again, in 5 years, who knows, this might be the way it all goes. What I would say about my job is every day is different. It's varied, and that's why I really love it. I like the variation personally. So I'll just kind of go through the general activities I do, if that is
That would be
useful.
brilliant, yeah.
So I run pharmacy-led clinics, and they are really all about patient consultation and negotiation in getting them to start immunosuppressants in the main, and then monitoring them, dose adjusting them. So it can be quite a full-on role, because sometimes the patients don't want to take these drugs, and so we really have to make sure that they're on board and feel empowered on why they need these medications, and then support them throughout that process. And that was a really big problem during COVID, because obviously no one wanted to be on anything which could increase their risk of getting COVID. So it was a tough time, but it was a really interesting time and really built up my skills there. We also run infusion clinics alongside our clinical nurse specialists. So we do fun things like makeup infusions, and we do lots of patient consultations. And it's a real nice way to see patients and interact with them and get to know them through the journey. And it's really nice when you see patients they're really not well, and then they're really well by the end of it. It makes you feel like you've really done a good job. We also have a pharmacy gastro helpline, and that is available to patients, healthcare professionals, both internal and external, to my hospital trust. So we get queries from other hospitals, we get queries from GP practices, we get queries from charities wanting some more information about medications. We're also part of the multidisciplinary team, and we attend their meetings, and we have 2 a week. I have one for liver and I have one for IBD. And within that, we present our own patients. So if we've got any concerns about patients, we present them personally, but we also give advice on drugs, and we really approve which drugs are going to be used. So without pharmacy, you wouldn't have that governance process. Do lots of governance activities, which doesn't sound very fun really, but I actually really enjoy them because it's a way of setting up really new and cool and innovative processes. So at the moment I'm working with our mental health team and a psychiatrist up in London to set up a pathway for hopefully dealing with fatigue for patients with IBD, which is a massive problem in IBD and often goes under managed and under sorted. So that sort of thing's really exciting. I do lots of education sessions. So I do education for pharmacy and for the MDT in undergrads, postgrads, and also on a regional and national basis through my role in the UK CPA. I do research activities, so I'm involved in quite a lot of research projects, both within the hospital, and I've been working with Connor on some undergrad projects. So we did some last year and we've got some this year, which has been really lovely. Other things as well, I work for charities like the Crohn's Colitis UK. I work for the British Society of Gastroenterology, really trying to get pharmacy in the forefront and giving the pharmacy point of view. And I get to do fun things like this. You know, the more you put yourself out there, the more you get asked to and be invited to do cool things like this, which is nice.
So not very much then in your average week.
No, that was
oh my god,
that was exhausting.
It was exhausting just listening to it, but it's also like my brain is sparking off of all these things that you're doing and linking it back to the stuff that our students are learning, and it, you know, particularly around, you know, and so I've obviously got an interest being a psychologist in the patient counselling and the idea that it's a negotiation between you and the patient as to whether the medication is something that they want to take.
Yeah. It's really nice, actually. We've been collecting a lot of feedback on our service recently from the patients directly, and the feedback we have had has been phenomenal. And we weren't selective in the patients that we sent it to. Each clinic we sent it out and hoped to get some feedback. And we're getting things like, if I hadn't had the pharmacy team there, I don't think I'd have started the medication. If I hadn't had the pharmacy team there, I wouldn't have continued with the medication. They're always there to answer my questions. And we're also sending the feedback out to the MDT, seeing what the doctors, the nurses, and teams like the admin team, which people I think forget, half of that, the NHS gets run by these amazing people. And we just try and make sure that we're involved with all the different aspects and we're getting excellent feedback from all of them. So it's a busy week, but I wouldn't have it any other way. I really enjoy it. So, yeah.
Well, yeah, I mean, it sounds like you enjoy it. It sounds like you have an incredibly important role in improving care for patients and not just at the individual level there as well. So the governance thing. Well, you said that you're working with a team of people around fatigue in patients with IBD.
Yep.
So what's the hope there? What are you going to end up with?
Yeah, so for that specific example, fatigue happens anywhere between 40 to 80% of the time within IBD, and it's debilitating fatigue. Like, you see some of the quotes from patients, and I'm only taking my annual leave so I can sleep. I can't do activities. I can't go and see my friends. My relationships are breaking down. It's really heartbreaking. And once you've gone through, okay, are they anemic? Have they got any vitamin B, vitamin D deficiencies? What else can it be? Now, sometimes it is due to the underlying inflammation that they've got. So we really need to get on top of that. But we're trying that with the medication. But are there any other factors we can work with? And basically, I went to a talk. And again, this is why I really promote any educational opportunity, because the things you pick up are always really interesting. And it was a renowned centre, St Mark's, so one of the world centres for IBD, and they had a psychiatrist there saying that they were starting to use antidepressants in patients with IBD to try and help with fatigue, either to help them have a better sleep pattern or because the fatigue was due to depression. Right. And so the pathway is very much going to be make sure we've sorted out the deficiencies first, so whether it's anemia, vitamin B12, vitamin D. Make sure that we are either getting the inflammation under control or it's all under control. Because what we don't want to be doing is putting people on antidepressants when they don't need to be. So we need to, I think, even as pharmacists, I think sometimes we're seen as drug pushers. I think there's always a prescribing choices not to prescribe as well. And I'm very much, as a pharmacist, let's try and get patients on the least amount of drugs to keep them well and safe. But if we've done all that and they're still really struggling, as I said, and this is poor quality of life we're talking about, offer them an antidepressant and explain it's not necessarily for depression, or it might be, but we're going to start it at very slow doses. We're going to support you and monitor you throughout. And if it doesn't work, you can come off this medication. That's the other thing as well. So, and I think with things like antidepressants, I hope, definitely from my experience, the conversation around mental health and its links is definitely changing. It's definitely seen as now a more positive thing. And so if you say the word antidepressant, people don't get upset about it. And that's the conversations we're having with our patients. Yeah,
a lot of the stigma's been taken away from antidepressants, thankfully.
Yeah, absolutely.
Yeah. I really like the other word that you used in talking about, consulting with patients was empowered, that you want patients to feel empowered. And I think that point that you made of maybe antidepressants is the way to go, but then maybe it's not going to be forever, and allowing people or giving people the knowledge that it's going to be up to them ultimately whether they stay with it or not.
Yeah,
Information is power.
Information is power. Who said that? There was a philosopher. Who was the philosopher?
They were a very clever person, whoever they were.
Philosophy. Well, philosophers are, I guess.
But I think as well with that empowerment, we know, and this is not just in the UK or Europe, this is across the world, that I think it's like 50% of prescribed drugs aren't taken. They're just stockpiled. Yeah. So if the patient isn't going to take it, I want to know that, because it's a waste of everyone's time, I think, because we think we're treating something and we're not treating it. And I think for drugs, for example, within IBD and some of the liver specialisms I do, it's very easy to see if people aren't taking it, because we can do levels on the drugs, we can do endoscopies, we can do liver scans, and if things aren't improving, they're probably not taking the medication. Yeah. Whereas something like fatigue, I can't sit in their bedroom, quite rightly, to make sure
You've never
they're
tried,
sleeping.
have you,
No,
Fiona?
definitely never
Okay,
tried, to
just
be
checking.
clear. So that's a very subjective, and we need the patient to be honest and open with us and to feel like it's okay to take this medication and they want to be on board with it. And
Yeah.
I said, if they don't, then we can take them off it in a obviously controlled and careful
Yeah,
way.
yeah. Good, thanks.
Fantastic. I want to be a gastropharmacist now.
You are a gastropharmacist.
You are, yeah. What are you on about? You forgot your job there for a moment.
So you've been a pharmacist for a number of years. I know our
That's very
listeners.
kind for saying a number of
Number
years.
of
I
years.
didn't want to say an actual
So
number
vague.
because people can start calculating. Right, how old is she? I know our listeners will be interested to hear a bit about how you got to where you are now. So why gastroenterology and what led you to this specialty?
Okay. So just for clarification, everyone, I used to teach Connor as a pre-reg trainee pharmacist.
Many
Baby
years ago.
Connor.
no.
Many years ago. So again, that was 2 degrees of pharmacy there. I know this is going out to the University of Brighton. I studied at the University of Brighton and I have a lot of fond memories, although I still see certain halls and that's where I had my exams and still feel a bit nauseous.
Oh,
so
Oh, really? Yeah.
if I go past Pharma, I always feel the
I
same.
teach in some of those places and it does make me feel a bit sick too.
Yeah.
Does it? Oh my
Yeah.
God, those connections are so strong.
Yeah, it's really interesting.
Yeah.
And even just walking here today, I got quite excited about coming back to my
Oh.
university. I always like coming back. And I've been very lucky to be invited back a few times, so it's been nice. So after studying at Brighton, where I had an amazing time, and I really did, I did want to move from Brighton. So I went and got my pre-reg, which is now the trainee pharmacist year, in Chelsea and Westminster in London. And I stayed there for my foundation, so residency years as well. And I really do believe this gave me probably one of the best groundings for my career. I got experience in general medicine, general surgery, women's and children's, mental health, cancer, general dispensary. It was just absolutely brilliant. I really loved it. I was doing at the time a lot of on-calls, a lot of weekends. And so I think there is there is a cap on how long you can do that for. That's why for doctors, when they do their F1s and F2s, it's 1 year and 1 year. You know, there is a time. So it did get to the point where I wanted to move on. And I was quite lucky at the time to be able to take a career break. So I went travelling. And while I was away, I was just really deciding what we wanted to do. And we decided we wanted to move back to sunny Brighton. So when I came back, I looked at jobs that were available. And there was a cancer job in the Brighton Hospital. At the time, it's called the Royal Sussex County Hospital. And because of all of my excellent skills that I picked up at Chel West, I was able to get that job, which was absolutely brilliant. So that was a specialist role then in cancer. And I was in that job for a really quite a long time, but it really did build on the skills from my pre-reg and foundation, but it gave me the specialist skills as well. And I got to be a non-medical prescriber again, which I did at University of Brighton, and I was doing clinics for cancer patients. While I was doing that, I was always getting involved in teaching. And so my education and training lead knew I really liked doing the teaching side of things. I think I would have been a teacher if I wasn't so scared of teenagers, quite frankly. And so they saw this health education role come up and they basically forced me to apply for it. I thought I'd never get it. It was a regional role that fed into national roles. You were going to be a programme facilitator over Kent, Surrey and Sussex. But I went for it and I got it, which was absolutely brilliant. But what I didn't want to do was lose my clinical aspect. So I took the education HEE role on part-time and then kept my cancer job going part-time. And what was really nice about doing that is everything I was teaching, I could relate still the clinical aspect. So I feel like the trainee pharmacists really did believe I knew how it felt to be there. I knew what they needed to know. But it also helped me really develop the programme. So I became things like OSCE lead, which is where I know Sian from. And I started developing more and more study days that had more of a clinical focus to try and help the trainee pharmacists, which always got really good feedback, which was very nice. Also, I chaired and led on projects that were really quite huge and ended up going kind of national or at least beyond our regions, which gave me skills for things like negotiation and organisation on a very large scale, which was great. I did that for a good couple of years, again, still keeping my cancer job. And then a role came up at the University of Sussex, sorry, rivals, as not anymore, as a module lead. And again, I could keep my cancer role. So
was that, was that on their pharmacy programme?
Exactly,
okay.
yeah. So I did that for the year. And I really loved it because I'd never set up a brand new module. It was for the cancer teaching. You know, I got to develop the whole curriculum. I got to work with all sorts of people that I wouldn't normally do. So that was excellent. But during that year, a role came up in gastroenterology, and that was a very clinic-based role. It was going to be full-time. And even though literally the last time I'd done gastroenterology was at Chell West some years previous, it had a lot to do with immunosuppressants. And with cancer, that's what I was good at, is immunosuppressants. So I had a talk with the lead of the team and just said, do you think I would be any good? And they just said, apply, absolutely. You've got the transferable skills. And again, I was very lucky to get that role, which was great. And I think this is a really good example of, okay, I didn't know lots about gastroenterology, but I knew lots about immunosuppressants. And so I felt comfortable in one area and I just had to build up my skills in another. And I had to change my whole scope of practice from my prescribing course to enable me to run the clinics and prescribe. But it was just a really good opportunity and too good to miss just because I didn't have a gastro background. And I just made sure I was available for all kind of gastro education that I could, whether that be ward rounds, sitting in clinics, actual education events, just general on-the-job training that you get. And then luckily, after about 3 years, I was promoted to the lead of that team, which is where I am now, and very much in the kind of developing the team stage. Alongside all of that, at some point, I don't really know when I fitted it in, if I'm honest, but I did a master's in global health via the London School of Health and Tropical Medicine, just because I thought that would be really interesting. And what I got off the back of that was doing a Chief Pharmaceutical Officer's Fellowship, again in the same topic, which meant that I got to do lots of volunteer work with Zambia over about 18 months to 2 years. Since I've been the lead in gastro, I haven't had as much time, but I'm hoping once we've got a bigger team, I'll be able to go back and work with them, because it was such a wonderful experience. If anyone gets a chance to do volunteer work in countries outside of Europe, it's a really wonderful thing to do. So definitely recommend it.
Fantastic. I mean, that was inspiring to listen to, really, wasn't it?
Absolutely, yeah, really inspiring. What strikes me with it is that how you've built your career since graduating, because I think it's easy to sometimes think that when students leave us,
that's it,
that we've prepared them for a career and then they're going to go and do it, and it's very sort of one chunk and then right now go and do the job. And it kind of makes sense of the phraseology a bit more to me now, that what they're going into is a foundation year. And this is the very beginning, and the career gets shaped after that. And the way you've explained your career path absolutely sort of shows how you're picking up skills as you go, you're maintaining your interest, going for different jobs, creating your own pathway. So that foundation year really is the beginning of something.
Yeah, and I think the more you can get from your foundation, the more opportunity you can get, and beyond your foundation as well. Like, don't close yourself off to opportunities, because I think looking back, if someone has said, what do you think you will do in your career, it wouldn't have been cancer, it wouldn't have been gastroenterology. I really loved mental health, still really like mental health. Now I'm getting to work with them. I forced my way in there. It's really interesting what you think you want to do and what you end up doing. And I really like my job, and it's definitely not somewhere I think I would have been. But also I took lots of opportunities for myself. If they weren't available, I made them. So I really wanted to learn more about kind of the world beyond Europe and America and our health system. So I wanted to do that master's to see if I could do any more kind of, I mean, I hate the phrase altruistic work, but that's what they call it, trying to do volunteer work and that sort of thing. It's in my own time, but it's very rewarding. So, you might not be able to get the opportunity directly in your workplace, but you can build those opportunities around, and then you get skills from that, which enable you then to get other roles, which is really useful.
Sian, you used a phrase the other week of lifelong learners.
Oh, did
and
I?
I think actually, Fiona, you've nicely encapsulated the idea of picking up opportunities where they come up, or creating opportunities that create your path and your learning and the things that you're interested in. So you could get two pharmacists in here who have completely different paths because the opportunities that have interested them or they've opened themselves up to have helped shape where they've ended up. So it's really nice to hear, and I'm hoping as the podcast goes on, we get some other people in who give a very different account of how they've ended up where they are. Yeah,
absolutely. So what next then? You know, you said that you wouldn't have predicted that you would be here now, so maybe it's an impossible question to say where are you going to be next? Who knows?
We
but
can
have
do
you
a
got
5-year
ideas?
follow-up and we can listen back and see if I stuck to it.
I'm sure the technology will be something quite different. We'll be like avatars. There will be the ABBA thing that's going on. We could do that. I'd be well up for that. No? No. Okay, fine.
I'll be with you, Sian. I'm happy.
Thank you very much, Fiona. But what do you think? Where next?
Yeah, so I am in the stages of building my consultant portfolio. So I'm aiming to be a consultant pharmacist in the next year. I'm using the RPS framework to do that. Not a plug, but that's the only way you can do it. It's hard work, but it's really shown me all the project work and all the development work that I've done and how useful it's been and how it's progressed not just my career but also the people around me. So that's been really worthwhile, and it has enabled, as I mentioned before, that feedback process to again see where we're good and where we need to develop, which has been excellent. I'm developing my team, which is really at the forefront of my role. So again, I mentioned those pathways earlier, so different roles we can do, but also what my team themselves can do. So we've got a wonderful pharmacy technician. If I could clone her and give her to everyone, I would. She's amazing.
I actually believe that you could clone. Like, given how you set your mind to doing something and then you achieve it, I think you could probably get into clothing.
So she's just a wonderful person and very enthusiastic, and I didn't want her being a pharmacy technician to dampen down her career prospects. So we've managed to get her accredited to do skills that are not normally trained within the pharmacy tech profession, and because of that now she's, for example, reviewing bloods and autonomously signing them off. I got it upgraded because of that, and we're now building her to actually do clinics alongside myself. So it will just give more robustness within the team. I'm also trying to get pharmacists more involved in areas where we don't normally get involved in. I was a bit pushy, quite frankly, and I got myself onto the British Society of Gastroenterology IBD committee. I just offered my services and they accepted, which is amazing.
They didn't already have a position for a pharmacist? Interesting.
Yeah, and again, that came out of networking, i.e. chatting, to people at conferences and just saying, I'm really interested in this. And then because they knew my name, I noticed they didn't have a pharmacist, I literally just emailed them and said, do you fancy having a pharmacist on the group? And
Fantastic.
they said, absolutely. Now, there's going to be an election process in a year or so time, as there should be. And then, that would give the opportunity probably to someone else. But it's about trying to get pharmacy, and I say pharmacy because I think it can be pharmacists or pharmacy technicians or whichever other role is developed within pharmacy in these areas. I'd like to continue working with the UK CPA because I really do love the education aspects and just to enhance pharmacy education, not just in gastroenterology, but those kind of transferable skills that are in the advanced level framework. I really, as I mentioned before, really enjoyed the charity work, and I'd like to get the time to get back and do that. I absolutely loved it. And I guess just doing more fun things like this. I mean, who'd have thought I've been asked to do a podcast?
Who would have thought?
Who would have thought it?
And by your very own Connor, who you used to teach. I have got a follow-up question about that.
Yes.
Was the hair situation the same? Was it bald on top, big beard? Was the hair distributed in a different way? I'm just interested, Connor. You don't need to look at me like that.
To be clear, I'm about 1.5 feet shorter than Connor. So
you had no insight as to...
So I'm not really sure of the top, but I'm always remembering the beard. Am I right with the beard?
I had a short beard and bleached blonde hair for a long time.
I'd love to see that.
Yeah, I used to have hair. What a surprise.
Bleached blonde. I would love to see that.
I don't remember the bleached blonde, but I just remember him always being very keen with the answering. He was always very engaged. And I do always remember the beard, but I just remember always standing next to him thinking, goodness, he's tall.
But that keenness, I mean, I think we keep coming back to it, but that sounds to me like the key to having an interesting career.
Mm-hmm.
And from everything that you have said, it's been generated by your interest in pharmacy, your interest in particular clinical areas, interest in travelling as well, interest in ensuring that you give good patient care that has led to you having such a interesting, successful career.
Yeah, I remember someone telling me once, not me personally at a conference, that there's no point in feeling sad about stuff if it's not happening. The only person that can change things is you.
Oh, I like that. No, hang on. We need to hear that one again. Say that again.
Yeah, it was just... I can't remember exactly how
There's
he said it now.
no point in getting sad about things.
Yeah, that's it. No point in getting sad about things
that aren't happening.
Just go out there and get the opportunities. So I think sometimes, for example, you can get frustrated because maybe the promotion that you're wanting in a certain area, there isn't a job. The job just isn't available. So, okay, if you enjoy your job, keep it at that, but then go and find other opportunities that are available to you. And and they don't always have to be, as I said, directly to your work. So my Zambia volunteering actually has nothing to do with cancer or with gastroenterology. It was all about antimicrobial stewardship. But that didn't make a difference because my transferable skills were still available. And what I got back from that was more than I'm sure I gave to the people. Like the skills I got from that, and just I absolutely adored it. So yeah, I think be enthusiastic. Don't just sit waiting for things to come to you. Go out and grab them yourself. And just keep talking to people. And eventually you'll find your people that are kind of willing and being able to help you get into the areas that you want to go to.
Definitely. You've brought up you've said transferable skills about 100 times, which I think it's something to kind of emphasise, really. Is, as a pharmacist, you've got a whole set of transferable skills. So, regardless of the clinical area, you're building a whole set of skills that mean that you could work anywhere that you wanted to if you put your mind to it.
Absolutely. And I think actually coming from a different area is sometimes really useful. So I think within a team, you should never employ really the same people, because otherwise you never get that holistic view. So I'm always trying to look for people that are different to me. So I will be challenged and things will progress. So we are very lucky. We've got someone coming in to join us that used to be a paediatric pharmacist. And they were really concerned about the gastro element in adults. And I just said, well, actually, what you can do is maybe take on the role of the paediatric to adult transfer, because they have all of those skills, they have all of that network, and that will then build up her confidence to employ everywhere else. So I actually think sometimes coming from a different area can be a benefit. I know when I came from cancer to gastroenterology, there were lots of things that I brought with me that improve processes dramatically, like safety in infusions and reducing observation times. We had to do lots of work on it and did audits and service reviews, but it really did help the service development and so better for the patient. So transferable skills all the way.
And also maybe different sites that you've worked at, so maybe specialty, but also not having worked your whole career in the same place. Do you find that working in different hospital settings has helped with what you're able to identify as well? Yeah,
I absolutely agree. So my site at the moment has two that I work across, and there may be possibility of working across more sites. And it's just good to meet new people, see how new services run, see what you can take from them. So basically stealing. And there's nothing wrong with that. Like, why reinvent the wheel? And just always keep talking to people. Introduce yourself to people, because people won't come looking for you. And then once you've made that connection, you can start sharing ideas.
Brilliant. I had another follow-up question, if you don't mind, Sian.
I don't mind in the
Just
slightest.
about prescribing, because we talked a little bit about prescribing, and I think it's quite interesting that you did your undergraduate here at the University of Brighton, and then a few years later came back and did your prescribing qualification with us as well. How was it transitioning back into being a student, knowing that you had all of that plethora of experience as a pharmacist?
Well, as you mentioned before, I think as pharmacists, we're just lifelong learners. You never stop being a student. Sorry to tell you guys. It never stops. So, after I did my trainee course, I started doing my diploma during my foundation, and then that carried on. And I think I may have had a year off before I started my prescribing course. So I don't really feel like I ever really came out of Studentville. And then after my prescribing course, I went into my master's. I think you've just always got to be very realistic with yourself when you're trying to do courses with work, though, because you'll find this, and courses include the training pharmacy year. You're doing a full-time job and you need to find time to do all of this work. So you just need to be kind to yourself, map it all out, don't leave it to the last minute.
Oh, yes.
Make sure that you know all the deadlines, make sure you know the ins and outs of the course, so you're not left running around like a headless chicken trying to get it resolved. So yeah, it's still the same planning, it's still the same amount of work, but unfortunately now you have a full-time job that you've also got to do alongside it. So I think it's harder, and again, I do feel as you get older, the capacity to remember stuff, it does get harder, but so far I've managed it. It's fine.
And just reassure everyone, you do have a personal life as well. You do have hobbies.
Yes, very much so.
Good.
I actually really believe in not being a pharmatron. I think you've got to
I
have.
love that.
Yep.
I think you've got to have a life outside of pharmacy. So I absolutely love going to gigs. I love traveling. So basically, when COVID hit, all of my hobbies went out the window. I love keeping fit. I've occasionally run half marathons, only occasionally. What other things? I love scuba diving. I've just taken up surfing. So
Wow. There's a lot that you fit into your time there.
Well, you only get one life, right?
You only get one life,
We
absolutely.
all have the same 24 hours, remember?
Oh, we do.
But also, I love a nap. Nothing wrong with a nap.
I love a nap.
That's what
What's
Sundays
your
are made for.
favourite time of the day for a nap?
3 and 4 o'clock in the afternoon.
How long is the perfect nap?
Oh, for me, about 25 minutes.
Okay.
Yeah. And that's another tip actually for work. Know what you're like in your day. So I know at 3, 4 o'clock, I start struggling
Yeah.
with lots of complex queries, concerns. So I always have jobs that are on the back burner that I can do when my brain just can't take that overload anymore.
Sure.
So I think it's really good to compartmentalize things in that way.
Definitely.
I did the same thing when I was studying. There were certain things that you could retain at 2 o'clock in the morning, and there are certain things you can't. Just don't push yourself. Know what your body can do.
Absolutely. Very good advice. And I was going to actually ask you, one of our questions is, if you could give one piece of advice to a student pharmacist, what would it be? You have offered loads of advice.
Yeah.
I'm taking away a lot from this. I'm sure
Can I
everyone who's
offer
listening
two,
will.
which are kind of linked?
I'm going to let you.
Thank you.
You're welcome.
So I would say the biggest thing is don't cut yourself off to opportunities. Don't think, oh, I definitely want to do cardiology and that's the only thing you're going to do. Speak to people around you and take those opportunities while you can. And then added to that, try and get yourself a mentor. And they don't have to be within pharmacy, or they don't have to be within your trust or your working place, but someone that is going to challenge you and say, actually, is that the right thing for you? Or why don't you try this? Why don't you try that? And it doesn't have to be the same mentor for all things, and it doesn't have to be the same mentor throughout your whole life. You don't get stuck with one person, that's it. I've had several, and I thank them so much for what they've done for me. So, yeah. So I kind of did two there. Sorry, I cheated.
I think that's excellent advice. Actually, Connor and I were talking a little bit about that before we came here today. We had a coffee. We were talking about research and where do you begin. And we were talking about
You
how
became my unofficial mentor in
wouldn't
that 15 minutes of caffeine.
Well, I mean, maybe. I mean, I'm very...
I'm not paying you for it, but thank you for the advice.
But, well, in that moment, maybe there was a little bit of mentoring going on, but we were talking about how if you can get yourself in a research team and find a mentor who can lead you through that aspect of your career, how important that would be and how much easier your journey would be. But I love your point that it doesn't have to be one. You will have different ones at different times for different reasons. And I think it's about knowing your capabilities, knowing the limit of your capabilities and how to stretch them forward a bit and having that support around you.
Yeah, and I think sometimes they can give you the confidence to ask for things, which is really important, because I think sometimes you get a bit like, well, it's not in my job description, so I can't do that. But when I worked at HEE, this opportunity came up to work for the GPHC, and so I asked my really supportive line manager, this probably means I'm going to have to take a couple of hours out every month or so. And he was just like, that's only going to give benefit to our group. So absolutely do it. So it's about finding the right people and framing the conversation to the benefit it's going to be to the team as well.
Yeah.
And if they're a good mentor, they'll absolutely support you. And if you're not getting that, as I said, find it from somewhere else.
Yeah, brilliant. Thank you. All right.
I think that's all we've got.
That's all we've got. We have got our unusual question.
So thank you so much for your time today, Fiona. We just had one last question for you.
Okay.
So we're going to send you off to a remote island where you're the only pharmacist, and you're going to be looking after a population of roughly 100 people. What are the 3 healthcare-related items that you would take with you, and why?
I have a quick follow-up question to that. Is it going to be sunny?
Oh, always sunny.
Okay.
Yeah.
In that case, sunscreen.
Okay, good.
If anyone knows me, I am very pale, and while I love the sun, I need to make sure that I'm not burning, and I worry for the British tanners in this country. As soon as the sun comes out, legs are out, no suntan, you just see bright red lobsters, especially on Brighton Beach. So definitely a lifetime supply for all of the inhabitants on the island of decent sunscreen. Probably rehydration salts, because we know if you're not hydrated, then that's it. So I'd make sure we have those. And I was toying up between antibiotics or pain relief.
Oh, interesting.
We
had a little conversation about this. I was all for the antibiotics.
Yeah,
but
I think I might go for pain relief because it can cover more things, but obviously I do know that means then that people are going to be unfortunately not getting well from their infections, but then also not going to be getting skin cancer either.
And they'll be doing it in a pain-free way.
Manner. Yeah, so I think they're my 3. Bizarrely, none of them from my specialty.
No, that's
doesn't have
fine,
to be.
no.
That's perfect. So the train leaves from Moulsecoomb to your desert island in the next half an hour.
Lovely.
So if you're ready.
I'm very excited. Sunscreen's in my bag.
Oh, some sunshine. It was literally snowing this morning.
Oh, my goodness.
Yeah. So, Connor, how are we going to measure success on this desert island of these healthcare items? Are we going to look at how many people have survived after 10 years? Are we going to look at
time 2? We'll do a Milan Kapler curve and look at what's our endpoint is death. Death or disease.
Yeah, or do we want...
How long do they all stay alive?
I'm going to take a more psychological perspective on things and say maybe we want to measure quality. I'm not going to go as naive as happy. I'm going to say quality of life.
See, I would go with you.
Thank you.
I was going to say happy.
Do you know what I say happy as well?
No, quality of life, I think.
And that's why you said painkillers over
Probably.
antibiotics.
Yes, that makes sense
Better
now.
quality
that makes
of life,
sense.
but they're all going to live for less time because they've got...
Yeah.
But they're happy
like
while
that.
doing it.
They're happy. I think quality of life is key, definitely.
Yeah, I think probably both are important. I think you want to live as long a life as possible in as good of health as possible with the highest quality of life. If we could have all 3, we would obviously go for all 3. And we've used up a lot of your time, which has been it's been better than okay, Fiona. It's been inspirational. Okay. It's been interesting. Yeah, it's been brilliant.
Well, I've really enjoyed the experience, and I'd really like to come back, even if it's just to see Sian's avatar, quite frankly. So, yeah.
I'm working on it. Yeah, I'm working on it. And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.